While we haven't found the fountain of youth just yet, we still would like to stay as young looking as possible. Hair loss and youthful skin tonight on Call with the Prairie Doc. Good evening and welcome to On Call with the Prairie Doc. From dandruff to cancer, our skin is open to attacks from many sources, creating concerns that have a variety of treatments. But first, let's take a look at this week's Prairie Doc quiz question. The most common type of skin cancer is A, malignant melanoma, B, squamous cell carcinoma, or C, basal cell carcinoma. Which is the most common type of skin cancer? We'll have the answer towards the end of tonight's program. Joining us tonight are Doctors Sarbacker of Dakota Dermatology in Sioux Falls and Dr. Jill Kruse of Avera Medical Group, Brookings. Thank you both for joining us. So we're going to talk about hair loss. We're going to talk about every skin condition that we can think of. We're going to talk about beauty. But I thought maybe we'd start with hair loss. Of course, guys struggle with that more than gals. But gals can do it too because you inherit loss, don't you? Can we do anything about the difference with inherited hair loss? Sarah?
A little. We're still not very good at making hair grow back. And I always tell people it really was only about a decade or so ago that we figured out you think like if you look at the whole hair follicle, we thought that when it died, it grew back from the bottom up. And it actually grows up from the little muscle that gives you goosebumps. So I always say if we don't really know how it worked, how do we know how to fix it?
Right. So we really don't know much, do we?
We don't.
Well, what about topical minoxidil? I mean, I had a patient who had uncontrollable hypertension in the 1980s. You weren't around, and neither were you when we were using minoxidil for severe hypertension. It's kind of like hydralazine. It was a vasodilator, powerful vasodilator. But this guy, he had kind of a normal hairline. By the time he was done, he had his hairline. It was down near his eyebrows. I mean, it was really quite something. And so I saw that hair growth with the minoxidil, and people took that and they used topical minoxidil. Are they still using topical minoxidil?
They are.
And to what effect?
I always tell people a third, a third, a third. A third probably maintain, a third grow some, and a third grow a lot. Never works as good as you'd like, but now it's inexpensive, it's over the counter.
Oh, it's over the counter?
It is, and it definitely works. And they've done studies with both women and men comparing strengths. Now they're all a 5%, and it's recommended that men use it twice a day and women use it once a day. But it's easy to use, it's relatively inexpensive.
Relatively inexpensive. Okay.
Is there still a recommendation of not women that are pregnant using it because of the risk?
I would say probably. Yeah.
And if you have low blood pressure, you probably might absorb some of it, or no?
I don't think so. I don't think it's enough to actually be an issue. It's a cap full of foam, and you're supposed to use 2/3 and put it on your scalp at bedtime. It's a little sticky. It makes your hair a little bit sticky. So best used at night and then washed out the next morning.
Oh, and you wash it off the next day.
Mm-hmm. And it really, it's one thing that they've actually proven grows hair.
At least it prevents it from going. So if you're starting to have a receding hairline that's more than you want, it's a minoxidil topical.
It is. Again, easy, safe. It's probably been on the market 25 years. It's been around a long time.
The question I would have is, so we've got one reasonably good treatment. Is there others? Are there other minoxidils?
There are others. Finasteride, which was a medication invented for prostates in the 70s.
Yeah.
That has been that they've done the studies. Oral, exactly. Oral.
But it's a testosterone blocker is how it works.
DHT blocker, so it blocks the receptor. So your testosterone actually should be normal. So it doesn't really block that. And they just recently, they did the studies back in the early 2000s with women, and they found out that it really didn't work, but now they've re-examined it because they think maybe they didn't test to the right doses. With men, they found out the most effective dose was 1 milligram, and so that's what they tested women, but now they're thinking maybe it's 2.5, maybe it's 5. Proscar's 5 milligrams.
Yeah, I'm saying the dose for prostate which shrinks benign prostatic hypertrophy is 5 milligrams, but you're saying we usually use 1 milligram in a man.
Correct.
And it helps prevent the hair loss.
It does.
It's a prescription drug.
It's a prescription drug. I saw one of the investigators, and she said when the men would come back for their follow-ups, they would be whistling in the hallway because they were happy it was working.
But if it decreases their sexual drive or affects their sexual function, they may not be whistling quite as loud.
And there has been and again, this medication's been around a long time. Did you think you ever saw that when they used Proscar, the 5 milligrams?
Oh, sexual dysfunction? Yeah, 5 milligrams, boom.
Right.
I mean, let's face it, the guys who are in the 50s to 60 age group or older, and they're wanting to get back to some sexual function that they've lost, and at the same time, they have some prostate problems, they really lose it when they use the finasteride. So I would just say you have to be cognizant of the fact that it may decrease your sexual function. Now, if somebody is not having regular sex, it's no big deal.
So you can look good or...
You draw the
Feel
women
good.
to you and then nothing works. But there is that issue. So you have, and I'm sure there are people who can do just fine with 1 milligram and their sexual function is unchanged.
I think that's been the thought, that it was a really a small percentage. But there has been some recent literature that suggests perhaps that even after you stop it, maybe you still have decreased sexual function. So that makes all of us nervous.
Yeah. So there are two kinds of prostate drugs. One is a quick reversal. The other is the finasteride, which is a long-term blocker of one of the components of the testosterone group.
And do the effects with minoxidil continue after you stop taking it? Because I thought it worked, and then as soon as you stop it,
the hair loss goes on. Yeah, you've got to continue the minoxidil,
right.
the topical minoxidil that we were talking about earlier.
And I always say it's like Tylenol for a headache. If you take your Tylenol and your headache hasn't gone away by itself, when your Tylenol wears off, it's going to come back.
You got the headache
right?
back.
So same thing with minoxidil. Like you just kind of go, you'd go to where you should be, and then the results should disappear slowly with time.
Okay.
But you shouldn't have abrupt shedding. It shouldn't be like, oh, I stopped, now I'm like, shouldn't be like that.
What about hair loss from chemotherapy? Because that's one of the things that I ran into. It just came off. It was clump, so I shaved. And it came back. Does it always come back?
I think almost always.
I think pretty much it does, but not everybody. There are people who, particularly with people who have bone marrow transplants, they get blasted really hard. And
maybe the radiation. They do have those cooling caps now. I've just read about them. I haven't, but you can, when you're doing some of those therapies, you do this cooling cap, and I think it.
I read an article recently about it, and the nurses who were giving me chemo said, "We've got, do you want to put a cooling cap in?" Nah. So let's talk about the philosophy of beauty. We age, we get older, we look older. Everybody seems to want to look younger. Has that been always the case? Is it different now? Why is it because of our advertisements and social networking? And what's Jill? Tell me what you think about the take of our patients' sense of beauty and need to stay younger looking.
Well, we say beauty is only skin deep, but now we want our skin to look great on the surface. Definitely with social media, there's Instagram filters, so people can look better than they look. And this has been in popular media, for a long time with airbrushing. Now it's kind of, with the filters, people can kind of do their own airbrushing and look better than they
really?
are. Yeah.
You can,
Yeah.
with the filters on.
With the filters
the
on your-
computer,
Yep.
on your computer.
Yep.
You can look good on the computer. It may be that you look a little older otherwise, though.
Yeah. So, I remember a famous quote from Cindy Crawford saying, "I wish I looked like Cindy Crawford on the magazine, because I don't even look like that."
Yeah.
So admitting that there was so much airbrushing in Photoshop and adjusting in media, and now it's kind of filtered down to mainstream.
Yeah, and the mainstream is people want to look younger. I will tell you this, my mother, who died more than 5 years ago, at 92, she said to me, when she was late 70s, I want to get rid of this. Can I? I was thinking about having some plastic surgery, and I thought, no, Mom, what are you thinking? And of course, I pushed that off, and then of course, it never happened. Plastic surgery. You talked about the sense that it gives people some sense of value, but women are hard on themselves.
Women are very hard on those, very critical of how they look, even when they look really good. And I think one of the things that's probably changed is now there are things you can actually do that are not all that complicated. So it makes you think, like Botox, for instance, is fairly easy to have done. It's some small injections. It's not out of reach as far as expense, so a lot of people can do it. Whereas, 20 years ago, we didn't have that. We couldn't do that. And one of the first things we started out with were the big lasers in the 90s, where the wrinkle lasers, where you peel off all your skin and your wrinkles go away, and which was a miserable thing to have done, a long recovery, sore face. And now everything's gotten so much simpler since then, so that it's easier to do some cosmetic things.
I would say this about the Botox, though. As a guy who watches TV, and I've seen, Jane Fonda and other women on TV and sitcoms, and their mouth is a little floppy, and you can see that they've got, you can see the Botox thing, and I'm going, why did you do that to yourself? And I knew a person who did that, and her lips were just as floppy and out of, that I don't sense that it made her prettier. And so I would say that, those wrinkles are hard. I've worked hard at these wrinkles. I should be willing to, love them. I think they're more for the person themselves than for the people who are around them.
But here's what I'd say. You look really great. You are very youthful looking, right? Wouldn't you say?
That's a nice
You know what I
thing
mean?
for
You
for
do
70. I'm not bad for 70, I suppose.
You look very good.
Thank you, my
Yeah,
dear.
you're right. You
And
really do.
I'll pay you later.
But some people just genetically don't age as well. They're probably, they age a little more, they wrinkle a little bit more, they maybe abuse the sun a little bit more, and
That's the sun that takes away their
lot of it.
beauty more than anything,
And
doesn't
smoking. I've seen smoke. If you want to age quickly and fast, smoke.
it? Smoke and get out in the sun without sunscreen. And
here's what I always think too. I do a lot of cosmetics in my practice, and I feel like I make people look good. And I feel like if you went to a party with some of the women that I've worked on, you wouldn't know that they do what they do. I mean, because that's my goal. My goal is just to restore, a little fullness here, a little. I mean, so that you don't have to look weird. You can look very natural and do some of that cosmetic stuff.
And it's important to find someone who is certified, board certified in this, not just someone who took a weekend CME course in Fort Lauderdale for 3 days and then came back and said, oh, I can do cosmetic procedures.
There are those.
There are those courses. And if I wanted to do, I could go down and say, 3 days, I could come and do Botox. Do I have any business doing Botox? No, I don't.
No, let's leave it to the dermatologist. You said that it really doesn't make you a lot of money because of the cost of the Botox.
Right, the products are very expensive.
But there are people who can get Botox for cheaper that's not as good at Botox.
There's 3 toxins on the market, and there's about to be a 4th, but they're all about the same price.
Pretty expensive. And insurance doesn't cover it.
Insurance doesn't cover. Yep.
Okay. Well, skin cancer can have many looks. We're going to shift to skin cancer now and be partially disguised as other less dangerous diseases.
I had this spot under my arm, just up from my elbow, not healing, and it just keeps scabbing over, and that's all it would amount to. Next time I'd be in for a checkup, he'd freeze it again, and So finally, when Katie took over, she said, when the scab comes off, come in and I'll take a test of it. And then sent me to the dermatologist here at the hospital. And they biopsied it, and it was skin cancer.
He went for a biopsy of his, on the lesion above his elbow. But the first thing she did, practicing her specialty, she takes her little light and magnifying glass and went to his face right away and found 3 areas that needed to be biopsied. So I was very happy with that. And then because of the Mohs procedure now, they take off a layer of skin at a time and they can tell exactly when they get all the cancer cells.
We went down to Sioux Falls to Dr. Knudsen. They biopsied
They did the Mohs procedure.
the one up here and here in my temple and by my ear. So they did 2 at a time, and they took the first 2. They got those 2 right away. The microscope said it was clear, so they sewed me up. And was it 2 weeks later or so, I had to come back for the other 2. The one under my arm, he had to do it again the second time. Then that's when they got it all. Well, it all come on so quickly, I didn't have a chance to. I just went with what they said and took care of it. But when I went down to Sioux Falls, I would have rather went to work than go down there. But it all turned out good. And I was thankful the microscope didn't lie when they said it was clear. So, and a lot of times I was without a cap or a hat or anything. Now I make sure I wear a hat when I'm outside.
That couple is they're wonderful people. The picture that we just looked at, it said, clothing is better than sunscreen, and a wide-brimmed hat, and so on and so forth. Do you agree with that?
I do like clothing. I'm a big clothing person.
And do you agree with that too?
I think they can be used in combination. I mean, so, you know, just because you have one, don't forget the other. So that's
Good point.
What I'd say. You can always tell when I go on CME conferences, you can always tell the dermatologist kids because they've got the cute little hats and the long,
long sleeves
on their pool outfits. So you can definitely tell them.
So your ex-partner, Jim McGran, who is now retired and who's been a guest on this show a million times, said several times to me during the show that sitting under a tree with a broad-brimmed hat, it gives your face sun protective factor 5 or lower than that, and that you've got to get sunscreen on top of that if you're going to be outside in a sunny day, for sure. And so you like.
I agree, but I do like shade. Shade in clothing, I think, is
important.
Some people treat sunscreen like it's a suit of armor. You know, they put it on and then they stay out all day. And you know, we talked earlier, and you said you put it on like every hour. You've got fair kids.
I have a redhead and a blonde, so.
And you're blue-eyed, and
yep.
you don't have a lot of pigment, Jill.
No, I do not.
You are pigmentless. And you're kind of pigmentless. Look at those blue eyes.
pretty
I've
white.
got blue-eyed
Yeah.
people. I'm a hazel.
They've done interesting studies, and about like almost everybody uses a quarter of the amount of sunscreen they're supposed to. So a quarter, not even a half. Mm-hmm. So you think when you think you really have to coat everything, it's hard to do.
So I've used a spray-on, the alcohol-based, because I can't. Greasy is not necessarily my favorite thing, and it takes so long.
Yes, it's pain.
And so when I'm on a sailing trip in the BVI, for example, I'll just spray on the spray stuff and then do it frequently because it doesn't take long. It's easy.
Yep.
What's your take on that?
I mean, it's not as good. Just because, and you think about that. Think about a coat of Vaseline, how it covers you compared to a spray. But I love the sprays because people will use them.
They'll actually put the darn
Yep.
thing on.
Exactly.
What about Blue Lizard? sunscreen. You know anything about Blue Lizard sunscreen? We've got a picture of it.
I've heard it's good.
Yep, it's
we
from
know-
Australia.
Australian, right?
It's Australian sunscreen, so
It-
I use it with my kids. I like it because their bottle turns blue when it's in UV light. So,
it
when
says-
it's blue, it's like, oh, you better put it on.
We better be putting on this, but you really, it's sort of like Coors that turn, when you got it cold enough
Yeah.
that the mountain, I don't know what it does. It does something. So, I've never drank Coors before.
Yeah, so that one is a like a chemical blocking. So there's two different types of sunscreen. One that just blocks the rays from getting into the skin, and one that like kind of reflects them back.
And
so
they're so different kind. What kind? I
So-
mean, we've got a picture. You
so
were
we're talking
putting on
about-
sunscreen on one
Yep.
of your children.
Yep.
Tell me what kind do you use on your children?
So I use a broad spectrum UVA, UVB. That's my daughter, making sure my husband doesn't miss his bald spot, because that's where he always burns, right there. So
Oh, that's a good thing. You need to put it right up there where
Yeah.
where hair is. He doesn't think his hair.
nope,
is,
he says he puts it on and then hits the little widow's peak in the front and then misses where it's receded back on the sides. So.
Well, us guys, we don't, we.
So his
But-
daughter's very good at protecting him.
So
from the
what
sun.
kind are you? Blue Lizard? Is that what you
I've
use?
used that. I've used all sorts of ones, as long as it's broad spectrum UVA, UVB. And at least 35 SPF.
Right.
They continue to try and revise the guidelines so that they're more, they're going to be water resistant, not waterproof. They're trying the FDA and the American Academy of Dermatology are trying to standardize them a little bit more. And the baby sunscreens tend to be those like some people can have problems with irritation, allergies. The baby sunscreens have more titanium dioxide, zinc dioxide, so they make you more white, but they're probably a better coverage.
The
Heavier, but they're a
The white
pain.
ones.
You turn a little white.
Well, and you get a little white, and you have to rub it a couple times before it finally disappears.
it's a hassle.
Yep.
Yeah.
But when you think of the old lifeguards with the white on their nose, that's what that was.
The screen shows the protective factor of sunscreen protection, and it points at 30 being an important level.
Right.
It's kind of the tipping point in the logarithmic scale. So some people think, 100 sunscreen is twice as good as 50, which is twice as good as
But it
25.
isn't.
But it's not.
it's
Really, when
just
you
a
hit
l-
that 30,
You're pretty close to there.
Right. Few percentages.
Okay.
yeah, you go from like 98 to 99.
So some farmers they say that farmers have sunburn on their left arm and their left face, and their wives have it on their right face and their right arms because.
Where they sit in the car.
But I've heard that the windows do protect against sun. It's like a sunscreen. What have you heard?
Yes, it does help.
It's not. It's like sun protective factor.
I
Don't know.
don't.
That's interesting. Well, I think that the idea of wearing sunscreen is because we're trying to do two things, right? One is to keep people beautiful, so they don't have to come in and do wrinkle therapy and so on and so forth. The other is to protect against skin cancers. Right. And we can go to skin cancer, but I've been instructed to talk about the little notches that people have so they look like they're angry all the time, the wrinkles. What can we do?
And that is people. I've had numerous women come in and say they don't like those wrinkles because they feel like it makes them look angry. And so really the most common thing we do is Botox, where we inject it and then you paralyze those muscles so that you can't make that frown. You can do things, there are some old-fashioned tapes, one's called Frownies and Winkies, and they're tapes that you put on overnight. You look a little goofy, but you tape your wrinkles open. And I always feel like it's the same concept as Botox. You're relaxing those wrinkles for a period of time so that they get better.
Where do you get those?
VermontCountryStore.com.
VermontCountryStore.com. It's cheap.
It is.
And it works.
And they work.
So one of the things, I had a lady who cleans sailboats in the British Virgin Islands come up to me and she said, I need to have this cream that you rub under my eyes so that my bags under my eyes go away. And so she wants me to write a prescription. Well, it's not a prescription, and it only works for about an hour. What do you know about that? Do you know about that, Jill? You don't know, but you know.
I do. My partner had a friend who used it, and she took before and after pictures, and
Amazing before and after.
It is. I mean, like, boom, it makes it swell, and it looks better.
Yeah, it swells.
Yes.
It causes an inflammatory response. You get swelling, and it lasts about 2 hours. And then in the middle of the party, the bags come
You
back.
deflate.
But you don't know it.
But it really, I mean, like, it was kind of crazy. I was surprised how much it helped. But of course, you don't really know what it is. You know, you can't tell from the ingredients. What is it?
And do you know what it is?
No.
And it's, you know, I told her, forget about it. You're lovely just the way you are. I've never noticed your bags. You know, get more sleep. You know what I mean? I don't know. Do you have any suggestion about bags otherwise?
I mean, you really have to, really to treat the under eye area. And I always feel like that kind of happens like late 30s, 40s. All of a sudden women are like, whoa. And you know, typically you need to have an eyelid lift or laser resurfacing. I mean, I don't think the eye creams help at all. You can do fillers down there too, but generally you need an intervention to make that better.
Okay. Yeah, okay. How about this flappy thing that my mother was worried about?
There's really two products. One is Kybella, which is an injection that dissolves the fat. Very expensive, very painful, and you probably have to do 3, 4, 5 treatments. It's not just one treatment, and it's called Kybella. It's been on the market 3 years now. And then there are different types of like fat shrinking things like Cool Sculpt and a bunch of different ones. Again, they're not perfect, but they help some.
Or plastic surgery?
Plastic surgery, but then you really have to, you bring it all the way. It's a big surgery. It's hard. The neck is hard. We're not very good at the neck.
Yeah. How about the spas? Part of this whole story about bags and the inflammatory thing, they say the same thing. You can do cucumbers or other fruit or something on your face and you get the same response, and that's why they do cucumbers. You always see the spas with cucumbers on their face and everything. Do you know anything about cucumbers? Do you know anything about spas, either one of you?
I like to go to them. Does that count?
They do your nails.
Do your nails, yep.
So, so there's a lot of things that's done in dermatology for beauty, but none of that is covered by insurance.
Correct.
What is covered by insurance?
Anything that is really medically necessary.
Cancer surgery.
Cancers, moles that look funny, eczema, psoriasis, acne, warts, nail problems, hair problems.
So let's talk about cancer of the skin. We know that there is an epidemic of malignant melanoma. Why is that? Jill, do you have a sense? I mean, is it that we have more sun exposure?
I would say that would be probably a good reason. Ages past, people covered up. I mean, you talk about prairie women, look at a Harvey Dunn picture. She's wearing long sleeve shirt and a dress down to her ankles and a bonnet because a tan was not considered beautiful. And then what happened was rich people started going to the French Riviera and they came back with this glowing tan. And so that was a way of showing that you were rich. So at one point, having a tan meant you were poor and you were working out in the sun, and now all of a sudden having tan meant you were rich enough to go and play in the sun and do absolutely nothing.
I have heard that. That is exactly right, isn't it? It used to mean you were poor, and then it turned into you were rich.
Rich enough to do nothing but sit in the sun all day.
What does it mean now?
Well, I would say when I was in high school, it meant you were going to prom.
Yeah, getting ready for prom.
Getting ready for prom or getting ready for a vacation. Now, I think people are just getting out in the sun. I think hopefully it will start getting better because people are being more aware of putting on. I mean, my generation growing up, we went to the pool with a bottle of baby oil because we wanted to get
you wanted the sunburn, so it turned into a brown. Well, now people go to suntan booths. I saw a sneer.
Ooh, I did.
A little sneer coming from the dermatologist. I know Jim McGran just went crazy when we talked about sun booths. What do you, I mean, do they do harm, and is there danger?
There is. You can get it on demand. And I think, too, a lot of times what happens is it's the whitest people who who want to have color, and they're not genetically, they can't have color. That just doesn't.
They make freckles.
Freckles, exactly.
Well, what are freckles?
I always say freckles are not angel kisses, they're sun damage. You weren't born with freckles. You don't have freckles on your tummy unless you've had lots of sun. You have freckles because you've had sun damage, even as a child.
Yeah.
Yep, and I read somewhere it was like having a blistering sunburn before the age of 10 dramatically increased your risk of skin cancer and
So
melanoma.
it's that 1 or 2 blistering sunburns that put you at risk for malignant melanoma. But I've had patients who had malignant melanoma between the toes where the sun don't shine.
Right. You can have melanoma your eye, your ear, any place where you have this melanocytes, which you have all over your body. You can have it, but it makes a big difference. You know, if you get more sun, you get it there. Statistically, women have it more on their legs. These are changing a little bit, but before men were wearing shorts like they wear nowadays. Men would have it on their back because we think they'd take off their shirt while they were roofing or whatever they were doing, and women would have it on their legs because they wore shorts. And again, that's changed a little bit, but.
Yeah, it's different. Well, and it used to be the question, the thing I used to tell my patients, moles, which are a pigmented spot, I used to say the same amount of malignant melanoma occurring on the mole occurs on non-mole areas, but that's wrong. Moles can turn malignant.
They can, but so moles can either turn into a melanoma, but it's more common that melanoma comes up and you think it's a mole because it's a brown spot.
So that's the real thing, isn't
Right.
it?
That there's
it
probably
looks like
more
a
of
mole.
that. Exactly. Looks like a mole, but it really is melanoma.
We have on the screen some symptoms, some story about malignant melanoma. It's here is the ABCDE of all kinds of cancer. Of course, this was typical. They did this for malignant melanoma, but it works for basal cell cancers and squamous cell cancers as well. So explain that. Jill, tell me about the ABCDE.
So asymmetry, if you can take the mole and fold it on itself and the two sides would match, that's good. If it doesn't, that's bad. Yep. So B is border. If it's got a nice, distinct, smooth border that you can see that's clear, that's good.
A sharp border, but a fuzzy border.
Fuzzy border where it's not clear, then that's bad. Yep. So C is color. So more than one color, bad.
Bad.
I know some people get so, oh, this mole is darker than the rest. Is that bad? Well, if it's one uniform color, I'm not as concerned as if there's a dark spot
and a pink spot
or a white spot in the center. That always makes me really worried if one area all of a sudden is dark black and then there's a pale area.
Right.
That's not good.
Multiple colors is a bad sign.
Yep. So D is diameter. I always tell patients if you can take a pencil eraser and cover up the mole, that's good.
Good.
Yep, if it's larger than a pencil eraser, 6 millimeters, then that's something you'd have to watch about. So, and then E is expanding. So is it getting bigger? Is it changing over time? And I'll tell people, take a picture of it. Take a picture of it with,
next to your fingernail.
Next to your fingernail or next to a ruler or a penny or something where you can get size. And then compare that year after year. So, now our EMR has capabilities of putting photos in, which is great. So we can compare. I know when I was in residency, they took out little slides, like the old slide projector, and would compare year to year. They're like, next slide, chink, next slide, chink,
and they would
project and would watch it changing over time. Yep.
The two things I would add to that too are with color, some smart person came up with what's called the ugly duckling sign, where you have that one mole that's really different than anything else. So that's kind of a clue. And then the latest study was, if you look at all those criteria, probably diameter is the one that most conclusively fits with the most diagnostic. So if you've got that big
larger,
mole, that's probably the most.
The most important one is the size.
Right, that was the most predictive of having a melanoma.
And before we go to the next roll-in, I wanted to, you quoted a Swedish study about sun exposure. I really, that fascinates me.
Interesting.
Let's hear that.
18,000 Swedish women, and they divided them into groups, and one group was sun seekers and one was sun avoiders. And then they looked at the death rate, like who dies sooner, if you get a lot of sun or if you don't get a lot of sun. What do you guys think?
Well, I heard the story already.
Yeah, I know, it's cheating.
So actually the sun avoiders died at the death rate of smokers. And then the sun seekers got more skin cancers, had to have more surgeries, but lived longer.
You know, and my sense is that because they're out doing things, they're going and moving, they're exercisers. I think it's the exercise.
The activity.
The activity, the people who are involved and enjoy outside. And there's something about that, I think.
Well, and I've seen studies on, like, if you take a walk in an urban area compared to a walk in a
open prairie.
Yes. You know, I think there's something about the outdoors that is really good for adult or humans. I mean, I'm not sure exactly what that is, but
well, and the whole vitamin D thing.
yeah, that's interesting.
I mean, there is data about, you know, people who have enough vitamin D have, you know, 1/3 less deaths over a 5-year period of time, same age. You know, so my middle age, so I think there is something about the fact that the sun is a wonderful thing. We just have to. I like the idea of sunscreen and
be a little careful.
Be careful. Yeah. Chronic skin disease such as rosacea can cause lifelong concerns, embarrassment, and scarring.
I would have pores that would get infected, basically, and they would be full of pus, basically, you know, and then they would pop and drain, you know. And that it's disfiguring. You know. So it caused me a lot of anguish over the years. I play Santa Claus in the wintertime, and I'd always tell the kids, well, I have a cousin that's a reindeer, you know. Some people just have a red nose. I had acne and rosacea. Yeah, you see a lot of people with huge noses that are all scarred and stuff. I've seen a few people that had it worse than I had. And I had rosacea from teenage years. I had a lot of serious problems with that. Got better when I graduated and was in the Army and stuff, and I controlled it, a lot of it with antibiotics. But I do a lot of programs and things like that, and Dr. Holm decided that maybe I could get some treatment at a dermatologist, because I'd never been to a dermatologist. And Dr. Sarbacker in Sioux Falls, I guess I was her first guinea pig, if you want to call it that. She literally took a laser and burnt my nose down to a cartilage, and then it grew back, and I haven't had any serious problems since then. Oh, I suppose it was like 3 weeks, maybe, that I had just a big black nose, and then eventually skin started to grow and it turned pink, and all the skin grew back. She did give me a prescription for an antibiotic, because occasionally I'll have a little flare up here and there, but I don't like antibiotics, or at least to take them on a regular basis. I start a beard in September, and I'm like the official Santa Claus for game fish and parks. I play Father Christmas at Fort Sisseton every year. I tried it with a fake beard one year, and it was no fun.
He's such an interesting man, very, very knowledgeable, very, very smart. And but he had this big swollen nose, and I referred him to you, and look at how handsome he is now.
He looks great.
And you know, I'll tell you, usually when I get when he would come into the office, we would spend 15 minutes. Shh, don't tell anybody. Talking about the history of evolution of humanity and the movement of the Vikings and the Indians. And I mean, he's just a fascinating man. He's very, very, very knowledgeable. Thank you for helping Dave for doing that.
My privilege.
So talk about rosacea. Acne is one thing. Rosacea is adult acne, right? Can you explain that a little
Well,
bit?
so acne is a plugging inside the hair follicle, and rosacea is inflammation around the outside of the hair follicle. And why? You know, because it's not necessarily in acne-prone people. And it hits about, you know, mid-adulthood, and all of a sudden, we really think about three components. You tend to have pimples and pustules through your nose and central face, and then erythema, redness, flushing, blushing, and then broken blood vessels. And rosacea in general can be a very nice disease to treat because you can make people better, they're happy, you're happy, but you do have some chronic antibiotics that, you know, we're trying to kind of get away from that. And people hate it, people hate to be red. We have some new products on the market now that have been really, really good. We have 2 new medications for redness, and what they actually do, they're kind of the component of like Afrin nasal spray, but they shrink your blood vessels down temporarily, so those have been really good ones.
Take away the redness.
Take away the redness, because again, people hate being red. A lot of times what I like to use too, there's different yellow powders instead of a tan makeup powder, a yellow powder that camouflages it. And then the last medication is there's been a new cream. It's probably 3 or 4 years old, and it's an anti-parasitic, Soolantra, and it's ivermectin.
And we think that some of this is parasitic induced.
Well, it's kind of interesting that we've always known that there's a mite in the hair follicle called Demodex.
I mean, a normal mite. I mean, everybody has it.
Everybody has them. Like you can kind of squeeze them out and look at them under the microscope. But the thought was maybe with those increased oil glands, do you have more of them? And so way back in the day, I would treat people with oral ivermectin, but I was just kind of a guess how long to do it, and I never felt like I had great success with it. But I was always nervous about using too much of it. And now it's in a cream,
topical.
and it is, boy, I think it's been superior to everything. Much better for redness.
So, I mean, these big noses, it's just so tough. I mean, because if you know, I remember seeing people, I mean, the point is, it's important to look nice.
Yes.
We want to look nice.
We
And
want to be distracting.
if somebody comes up to you and go, oh my gosh, look at her eyebrow or her, you know, her nose or something,
Yes.
we all go, and that's what we're thinking. We're not thinking, gee, what is she saying? What a lovely person, you know. So I'm afraid that beauty is too important to us, is what I'm thinking. You know, beauty is only skin deep. The real value of a human is their golden heart.
I agree, totally.
So put away all that, we must be beautiful, we must be beautiful. But at the same time, you know, we shouldn't ignore some things that distract other people from being able to be comfortable with you.
Right.
I'm talking too much. We have a call. This is a question that came from the clinic today. An 18-year-old has had a fine, bumpy rash on his face and trunk for about a month. At first it looked like hand, foot, and mouth. The blister-like lesions resolved, his fingertips and toes peeled. The rash has not gone away, however. He's happy, doesn't have other symptoms. He's negative for strep. He doesn't have any new skin products. Is there any other idea besides this being a viral rash? So obviously that's Joni, the nurse practitioner, saw this. It looks like hand, foot, and mouth. It acted like hand, foot, and mouth, right? How would you describe hand, foot, and mouth?
Well, those are usually blisters or vesicles on the palms of the hands, on the mouth, on the what we call the buccal mucosa, and on the soles of the feet. Also can be on the bottom. So, but
it's a viral infection.
But it's a viral infection. Yep, very common in kids. So.
But it goes away. And she says that this guy has a fine bumpy rash on his face and trunk for about a month. Do you have any clues?
I think that could still be viral. I think that could
That's
still
what-
potentially go away.
I think that would be my suspicion too. So we've got some time to go forward. I wanted to talk about weird diagnoses. A lot of scaly, the classic is a papulosquamous eruption. And the most common is dry skin with scaling back because they've been sitting under the shower. The hot shower takes all their oil. They soap up really big, even though they don't need it. And then they end up with this dry skin. And how do you handle a person who's got that terrible back, some winter itch?
Winter itch. Well, trying to convince them not to use so much soap and a good moisturizer. Putting the moisturizer on after they've been in the shower. So
Before they completely dry out.
Right,
Like
so-
within 2 minutes or something.
Right, so you want that moisture to lock in. And like I said, an old dermatologist I shadowed with and studied under, he said, "I'll use Vaseline and then buff it in like wax on a car."
You know, and
it works.
I have turned to Vaseline for the hands. Before I go to bed at night, I put a big old glob of Vaseline on my hands, and then, while I'm at it, smear it all over my face and my neck, and then that's why a 70-year-old guy
Right?
looks
Look
this
how
bad.
good he looks.
But Vaseline
Yeah.
is an important one. I think that works. But you talked about CeraVe because it has ceramide, and there's a lot of agents that have ceramide. Do you have any other suggestion besides what she said about dry skin, besides CeraVe or Vaseline?
And that's, don't, especially men, suds head to toe. Don't suds head to toe. You know, I always say the high value targets, hit those.
I always say the hairy spots.
Right? That's
High value targets.
I also just bought myself about 3 years ago it's a back thing that has like a little cotton pad on there that you put lotion on so I can get my back, because my family doesn't like to put lotion on my back, and it's hard to get to.
Right.
Yeah. And one thing I find that parents, that seems to be a lot with kids, you know, thinking, well, their routine is to take a bath every single night. And I was like, your kid does not need a bath. I really don't think your 6-month-old is sweating.
Right.
I mean, so.
Actually, since I'm semi-retired right now, I'm not taking showers, but and I'm not running as much as I used to. I'm trying to walk every day, but I'm not taking these big, long, hot showers. I mean, I used to do it because I'd do my hair, because we all want to have our hair look good.
Yes.
Well, I've turned to forgetting about my hair, or just dumping it in the sink and cleaning it that way.
And definitely with aging, we don't produce the oil that we used to. You think that greasy teenager versus an adult, as you age,
Yeah.
you don't produce as
You
much
don't-
oil.
Yeah. Okay, so we've got 1 minute. Take-home message you want to make sure, and I'll give you that too.
I love this product for acne. It's called Differin Gel. It's Differin OTC Gel. It used to be a prescription, now it's over-the-counter.
Differin.
IN, yep. And you can find it any drugstore, and it's great to start kids' acne with.
Okay. and
Unplugs, prevents.
Prevents. So Differin gel,
Gel.
over the counter, not that expensive.
Nope. Great product.
20 seconds.
Best way to look young and stay young, don't smoke and use sunscreen.
And what a joy to have the two of you together. I know this is not a live show, but it'll be on in very, very short order. And now for the answer to tonight's Prairie Doc quiz question. The most common type of skin cancer: A, melanoma; B, squamous cell carcinoma; C, basal cell carcinoma. Answer?
Basal cell.
Very common, although malignant melanoma is increasing in frequency, isn't it? We'll be right back after this.
For more than 16 years, the Prairie Doc organization has endeavored to enhance health and diminish suffering by providing useful information based on honest science in a respectful and compassionate manner. Prairie Doc physicians and health professionals continue to answer your questions each week, creating a vast Prairie Doc library of medical information available to you and your family 24 hours a day. Make sure you don't miss a thing. Follow the Prairie Doc on Facebook and YouTube for free and easy access to the entire Prairie Doc library.
Remember the Greek myth of Narcissus, a vain and handsome young man who was punished by a goddess for rejecting the innocent love of another? Narcissus was made to fall in love with his own reflection in a pool, and he wasted the rest of his life staring at his own image. It's easy to criticize our society's obsession with beauty. We all know beauty is only skin deep, and people's outward appearance sometimes does not reflect their inner goodness or lack of it. We also know that the cover-up of the wrinkles of aging, with faces pulled tight from surgery or injections of tissue expanders into lips, usually make movie stars appear even more artificial and unreal. Naturally, we all want to make a good first impression. In the wild, it's the bird with the most colorful feathers that successfully woos the most healthy and finest specimen of the opposite sex in order to advance the species. Looking good is important for getting a job, selling a product, or even making a convincing argument. To dress and appear well groomed and to look clean and healthy provides the appearance that someone has their act together. It is human nature and practical to want to look nice. Our epidemic of obesity, alongside society's definition that thin is desirable, is a disheartening paradox. More troubling is that, short of radical and dangerous surgery, weight loss programs do not last. After 5 years, most programs and efforts show only 1 in 100 are able to keep weight off. We would be healthier if we emphasized eating right rather than weight loss. Besides, what is true beauty? Does it really matter the measure of the waist, the turn of the nose, or the color of the hair? Are we most charmed by the impression of youth or that of experience? The look of innocence or that of confidence? The appearance of cool or that of compassion? Certainly, what seems beautiful today will be different tomorrow. Looking nice can be important, but in my opinion, it's valuable to recognize that it is the golden heart and a healthy lifestyle which makes one beautiful. Exercising well, eating a balanced, reasonable diet, connecting with and caring for friends and family, and finally, loving ourselves are the elements which bring on real and lasting beauty. Narcissus wasted his life above a calm pool, looking at himself, but we can do better. Well, a great big thank you to our guests, Dr. Sarah Sarbacker and Dr. Jill Kruse, for joining us today. What a wonderful, it's volunteering that they do to come to our studio in Yeager Hall on the campus of South Dakota State University. They brought great insight to tonight's discussion. Remember, limit sun exposure, watch for changes in moles and skin lesions, and use that sunscreen. Well, that does it for tonight. From all of us here at On Call with the Prairie Doc, until next time, stay healthy out there, people.
All of us want our family, neighbors, and friends to have the ability to make appropriate decisions about their health care. To do so, they need access to information from reliable sources like Dr. Holm and his guest physicians. Hello, I'm Stephanie Herseth-Sandlin, and I serve on the volunteer board of directors of the Healing Words Foundation, a 501c3 organization established to support the work of the Prairie Docs. With your charitable donation, you can help the foundation continue to offer free and easy access to the entire library of Prairie Doc health education programs. This mission is so very important to rural communities and residents in particular across South Dakota and neighboring states. Please consider a personal or corporate gift. Just go to prairiedoc.org to find more information on how you can help. Thank you.
Major funding for On Call with the Prairie Doc has been provided by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On-Call Television as it continues to open doors for important medical information.
And by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota,
and with the ongoing support of these individuals and institutions.
Brookings Health System,
Ophthalmology Limited,
American Academy of Family Physicians Foundation and South Dakota Academy of Family Physicians,
Avera Heart Hospital,
Dakota Allergy and Asthma,
CoBank,
Fishback Financial Corporation,
Vance Thompson Vision,
Urology Specialists,
Brown Clinic,
Black Hills Medical Society,
Aberdeen District Medical Society,
3rd District Medical Society,
7th District Medical Society,
Dakota Bank,
Orthopedic Institute,
Physicians Care Sanford Clinic Community Service Committee,
Aberdeen Asthma and Allergy,
and Swiftel Communications.